Kumul Petroleum is much more than the national petroleum and energy company. It's a company with a heart for health. Kumul Petroleum is very aware that as the nation's population steadily rises, this places an increasing strain on the government health provision, both basic and more specialist medical services. As the country develops and urban populations get larger, there is an increasing incidence of lifestyle diseases such as cancer and heart-related complaints. Heart disease is one of the top 10 causes of death in PNG, causing 13% of all deaths. As the national petroleum and energy company, Kumul Petroleum has a duty of care to support the nation's health services through strategic interventions such as contributing to the construction of health sector infrastructure. This is what we have done at Port Moresby General Hospital. Kumul Petroleum has signed a tripartite agreement with the National Department of Health and the Port Moresby General Hospital to support the establishment of a National Heart Centre. Under this agreement, Kumul Petroleum committed to fund 50 million kina over a 5-year period. The construction and renovation of the National Heart Centre infrastructure is now complete. Essential staff have been recruited and specialist equipment acquired. Just 1 month after interventional cardiologist Dr. Pham Kong Nam arrived in the country, the first ever stenting procedure in PNG was carried out. In April 2022, during the visit of Her Royal Highness Princess Anne, as part of the Queen's Platinum Jubilee celebrations, officially opened what is now known as the Kumul Petroleum National Heart Centre. Now people can visit Port Moresby General Hospital for a consultation with a heart specialist, be tested to assess their heart function, and if necessary, undergo surgical procedures to correct their condition. Since the refurbishment of the cardiothoracic ward and the cardiac diagnostic centre, and up to mid-2021, more than 1,200 stenting procedures have been carried out at the National Heart Centre. This is a really meaningful outcome for the country, since previously, people suffering from heart diseases, and only those who were able to, had to travel overseas for treatment. A very costly exercise. Sadly, many were unable to go overseas. We are proud that Kumul Petroleum's intervention has saved lives. Cancer is the 4th largest cause of deaths in Papua New Guinea. Kumul Petroleum has contributed 10 million kina to assist in the expansion of cancer treatment facilities at the Port Moresby General Hospital. Work that is still underway, so that this facility has a greater capacity to be able to look after more people suffering from this disease. Kumul Petroleum has also committed to support cancer treatment at the Angao Memorial Hospital in Lae, to the tune of 15 million kina over 3 years. This support continues and includes the recruitment of an oncologist and support staff. To complement its current support for the hospital, the proceeds of the Kumul Petroleum annual charity golf event held in Lae every year raises funds to purchase chemotherapy treatment drugs for use in Angao Memorial Hospital. Kumul Petroleum also contributed 1 million kina towards the establishment of a kidney dialysis unit at Mendi Hospital in the Southern Highlands Province, which opened in April 2023. This will be the only facility of its kind in the Highlands region. Kumul Petroleum has also made donations of medical equipment, each worth more than 500,000 kina, to Kiunga and Nonga base hospitals, as well as donations of ambulances to rural health facilities. Donated medical equipment enhances the healthcare services of these medical facilities. For example, an ECG and other scanning equipment provided to Kiunga Hospital was used to scan more than 500 patients in 2022 alone and has decreased preventable disease morbidity and mortality in that area. It's not just equipment or another medical examination. It's a reflection of Kumul Petroleum's commitment to the people of the country. Kumul Petroleum really does have a heart for health, a commitment to support both general and specialist health services in hospitals around Papua New Guinea.